Well, people on long-term medication for conditions like HIV and tuberculosis may be reluctant to fetch their prescriptions due to COVID-19. The Gauteng Health Department this week revealed it's aware of more than 1,000 cases of people not fetching their pills. For more on this, I'm joined by Bekisisa Center for Health Journalism editor, Malan. Mia, good evening and thank you so much for your time. It's interesting because a couple of weeks back, SANEC also raised alarm around the number of people that haven't been able to collect their medication. It's worried about the long-term implications of this. How deep a problem is the issue of medicine collection?
So as you've mentioned, the Gauteng Health Department this week, for instance, said that up to a fifth of people with HIV in the province are not collecting their treatment any longer. Now, this is dangerous because it doesn't just make them more vulnerable to develop resistance to HIV treatment, so that the same treatment wouldn't work if they use it again, but it also allows people with HIV's immune systems to weaken, which in turn makes them more vulnerable to develop TB. And the reality is that people with TB really shouldn't be hanging out at clinics during our COVID outbreak because health facilities are likely, or some have already become hotspots for coronavirus infection. And in addition to this, it's not just the collection, it is also that TB and HIV treatment production has been interrupted by lockdowns in the countries where the drugs are being produced, and some of those manufacturers now prioritize producing COVID testing kits or reagents, so the capacity to produce HIV and TB treatment is also lower.
If one is getting their medication from a clinic, Mia, I imagine that part of the difficulty now is that if your clinic is shut down because of a positive case that was found there, you're simply left in the lurch. Have there been alternatives created where perhaps people are able to drop this medication off instead of relying on the patients to come fetch it?
So for TB, there are NGOs that work with TB that have started to drop off TB treatments in the communities at, for instance, community halls. For testing, because it's not just the treatment that's a problem, it's also to test people. So one suggestion is that if field workers who go out into communities to screen for people with COVID-19, that they also screen them for TB and HIV and send them for testing if it's required. But that, of course, adds to their workload. And for treatment, doctors have started to give some people with HIV 6 months prescriptions as opposed to 2 months or 3 months, so that they don't have to often visit clinics. But they can only really do that with patients who have no treatment complications and for who the treatment is doing well. And in some areas in South Africa, there are medicine dispensing machines in shopping centers that look like ATM machines. I think there are about 5 across the country, where patients can collect their chronic treatment monthly and then speak to a pharmacist online. And there are efforts to expand this across the country, but it's of course really costly, so it's an issue about money.
I tell you what, Mia, it looks like you try to plug one hole and another comes open. There's so many issues that COVID-19, of course, has left our state with, you know, and some of the problems, I think, are indirect effects of trying to deal with the virus. But certainly the issue of the HIV/AIDS treatment and the tuberculosis treatment is a big and an important one for those who are taking that treatment.